And we are back at the Lance Roberts Show, Financial Fitness Friday, the Black Sheep. I'm in a rare mood today. I only slept 4 hours, so bear with me, everybody. Bear with me. Hey, we got one financial myth. We always like to do a financial myth. So one of my favorite sites, websites, and you should probably take a look at it as well, because I'm very passionate about people understanding what healthcare costs look like in retirement and how much bad health can cost. I'm writing a piece right now that should be out next week about questions you should be asking yourself in your financial plan about your health, and maybe even your advisors should be asking you. And I will tell you, if you think people don't like to talk about their money, they do not like to talk about their health and their bad habits. They don't like to accept those, but it's best you do that. So the Kaiser Foundation, Family Foundation, KFF.org, is one of the best sites for healthcare intelligence, as I call it. And one of the myths out there is about Medicare and what it covers. One thing that Medicare doesn't believe in is your teeth. Medicare believes that you should be toothless because dental doesn't care. They don't care about your teeth. You know, bad teeth, not only do bad teeth make you miserable, but it opens up a slew of other healthcare related issues in your body. So KFF.org did a study drilling down on Medicare beneficiaries and finding out most Medicare beneficiaries lack dental coverage. And many go. 2/3 of Medicare beneficiaries, 37 million people, do not have dental coverage, and many go without needed care. And the KFF brief was sort of shocking to me, okay, that half of the Medicare recipients do not or have not been to the dentist in the past year, okay? It is amazing to me, first of all, that oral health and Medicare do not seem to work together, okay? Brent, I don't get it. I mean, I just, not only do you, when you read this brief, realize how poor dental health is for seniors, but it's just the fact that it's just not important.
Well, and a lot of dental health can be a precursor to diagnosing other ailments in the human mechanism.
That's exactly right. But a lot of seniors do not have the out-of-pocket money, okay, to pay for these costs. Mm-hmm. So, I mean, Medicare Advantage perhaps will be looking at some form of dental coverage down the road. I've read some briefings on that, but the most expensive dental services that are needed by older adults go ignored. So they go with chronic pain, preventable infections and complications, and so forth. That again, don't do that. Now they get ignored. Now I will tell you, there are private. What I've noticed, the private sector has come in to try to fill the gap. There are plans that are blossoming out there for seniors to buy private insurance. Or work with a dentist one-on-one. Sometimes dentists will help you self-insure and provide, believe it or not, dental coverage to seniors. So you need to ask your dentist if you're going. Okay, it's very important as a senior that you do this. It's very important. You know, I think I told you about, Brent, my exercise. About how I got to eat right over the last couple of years working out. By the way, I'm going to give Orange Theory a plug because I love you guys. You help me to stay sane, but it's a very high-intensity workout.
You look great. I mean, I want to compliment you. In the past 2 years, I've been able to tell a difference.
Really?
Yeah. Oh, yeah.
I feel better.
You look healthier.
Yeah, and because here's what I've done. I have attached retirement dollars, to good and bad habits. Now, I don't literally move money around, okay, between accounts. Yeah. But what I do is, okay, if I eat this cheeseburger, what is it going to cost me in retirement as far as health care costs?
Right.
So I'm going to have to deduct $50 out of my retirement account.
That's an expensive cheeseburger.
Yes, because I look at what health care costs are in retirement. And again, it's a mental... Listen, you can trick your brain to do anything, okay? I've learned to look at food and exercise and certain things as... how is it going to affect my quality of life and my healthcare expenses in retirement? Because I see every day what healthcare expenses do to people in retirement. So not only that, even if they have the money, the quality of their retirement.
Yes.
And I have clients that'll lament to me. They'll go, retirement is just not what I expected. And it's not because they don't have the money. It's because their health has failed earlier than they thought it should.
Right.
And it's because of some of the habits that they've had. So I have learned to attach a dollar amount, which I'm writing about in this piece for Lance, to everything that I do. And what it does is it's tricked my brain to step back.
Yeah.
I may still have the cheeseburger because I'm saying, oh, you know what? I haven't cheated in a while and I'm okay to do it. Maybe I just won't have the fries with it. Maybe I'll have a salad with it. I'll skip something. I won't have the cheese on it. I'll compromise.
Well, like Keith Klein says, and by the way, we're going to have him on the show sometime.
Is he coming
month.
on finally?
A little bit later this month.
Yes, Keith.
He says every once in a while, it's okay to indulge.
Your body can handle
everything in moderation. Besides, cheeseburgers are good for your coat.
My coat.
Your coat.
Oh, I thought my back hair.
No.
Oh,
that too.
Oh, okay, but I think it's so important. So and I think it's all important to make sure that you go on your annual physicals, which I've been doing, and I've noticed guys are the worst with this.
Oh, we
Why
hate,
are
we
men
hate it.
and men in Texas are even worse? I mean, my grandfathers were horrible with this in New York, but Texas men are like, feels good, don't need to go. Okay, all right.
If I'm sick, I'll tell you.
If I'm dead, you'll know.
Yeah.
I mean, I appreciate all the cool cliches and all that, but all the funny things I get. But I just look at the costs of what it's going to be. And what you're finding today, and Carolyn McClanahan is one of the forefront financial planners who does this. She's also an MD, by the way. And she donates a lot of her services. She's really wonderful. But she is starting to bring to the forefront to advisors the importance of discussion of healthcare to clients and bringing up this topic overall. And I think it's important as well. I think, Brent, though, I think with many people, they are going to feel that it's intrusive. Like, why is my financial planner asking me about if I'm going for my annual? Mr. Jones, have you had your colonoscopy? They're going to think, wait, who are you? You're supposed to help me with my money. But healthcare and money are very tightly knit.
You see how big a chunk healthcare is going to take up of that money in retirement.
Well,
and that's why
again,
the financial planner has a point.
Exactly. Studies vary, right, from $280,000 all the way to $400,000. And again, that's not a lump sum, but it's what you're going to pay in not only Medicare premiums, but also above and beyond those premiums. And also, I'm scared to death of long-term care costs for people and what that's going to be. So with Keith Klein, what I want to talk to Keith about is, and Keith is like one of the forefront of. Do you ever notice the stuff he puts on Facebook about people he's helped to transform? I don't even know. He shows somebody that looks like
the before and after pictures.
Yes, they're amazing.
Yes,
and they're not. And these people are not doing anything like they're not running marathons or anything else.
Photoshop either.
This
is the real deal.
It is amazing. Okay. Now, you may not want to get to that level of fitness, but the most important part is what Keith helps you do is look at how food. You think that brokers can rip you off, and brokers don't tell you the food story? I want to tell you that about food labels. Okay, Keith is like the Columbo of food labels. He goes in there and shows you. You think this is low fat? Well, let me show you this. And then I'm like, okay, that's another food, Keith, I cannot eat. Thank you for that. But so he's the food detective, and we'll have him on. So the myth buster is dental coverage is not covered by Medicare, but you do need to account for dental coverage in retirement through some form of private entity. And you may not realize your dentist could be the first source of that insurance. So we have financial guardrails, and these guardrails are available to you at RAA off of our website at Real Investment Advice on the blog. Very popular blog. We're one of the top blogs in the country when it comes to investment advice. And we have, over close to, I'm guessing here, we have 9 of those. And I wrote these, and I should know. But we write so much stuff here. Okay, I call it the conveyor belt of financial writing. If you go to the blog at Real Investment Advice, we write every day. Jesse Colombo, John Camarianos, Mike Leibowitz, what's that guy's name? Lance, me. We write Danny, we write all kinds of stuff. Last week I wrote about if you're going to get a severance package, right? What do you need to consider? I didn't make it seem to sound as negative as it was because some people are getting severance packages close to retirement, and they're very grateful for those. They just need to assess what the pros and the cons and be aware of certain things when it comes to their severance, especially when it comes up to COBRA and Medicare coverage overall. But one of the guardrails we have, and this is one of my pet peeves, is when you run your financial plan, you've got to remember that you have to have realistic return projections, time horizons, and inflation factors. Those are crucial. Let me tell you, planning, like anything else, is far from perfect, okay? You have to work with projected returns on risk assets like stocks and so forth. You've got to look at how long a person may live. Well, thanks, Magic 8 Ball, for telling me how that's going to work, and what inflation is going to be at the time of retirement. The problem that I have is that most financial planning software comes out of a box, just like when you buy a program for your computer. I just bought the screenwriting software that's driving me crazy, even though it's easy to use because I got to learn a new program. So your advisor is responsible for setting proper inflation rates. It's not 3% across the board. What if you do have healthcare costs? What if you do get ill more than others? Well, your healthcare costs are going to be different than somebody else's. Daily healthcare costs, daily costs of living are not as high as you think. Now, I'm saying that and people are going to yell at me, but what I'm saying is there are certain things that you do, you're going to find that those costs don't go up. If you like electronics, for example, well, listen, you can buy what? I remember those TVs that you used to be able to get, whatever they are, the high defs. When they first came out, they're like $4,000. Now they're like, what, $400? So you got to be careful that your advisor is putting in proper numbers or your plan is going to be junk. And I want to talk about that when we get back here on the show. And again, you are listening to Financial Fitness Friday of the Lance Roberts Show on 700 KSEV, the voice of Texas. Stay tuned.
Sun or the rain, it be like they are. Come on, baby, fear the reaper. Baby, take my hand, fear the reaper. We'll be able to fly, fear the reaper. Baby, I'm your man.
Get daily investment news you can use, delivered at the speed of the internet. Sign up for Lance's newsletter now at lancerobertshow.com.